Hello and welcome. And today I'm very pleased that we're going to be talking to Dr. Don Thomas, and we're going to be discussing an autoimmune disease called lupus. Now, if you're anything like me, I have heard of it, or I believe I've heard of it, but if someone asked me what is it, I would have no idea. And so Don is going to be here to discuss the condition with us. So just very quickly, as a bit of background, Don is an associate professor of medicine at the Uniformed Services University in Maryland and teaches at the Walter Reed National Military Medical Center. And he is in private practice, specializing with patients with lupus, along with many other things. So Don, perhaps it'd be better for you to tell everyone your whole string of accomplishments.
Sure. Katrina, I practice in private practice in Greenbelt, Maryland. It's a suburb of Washington, D.C., in Maryland. I did my rheumatology fellowship at Walter Reed Army Medical Center, which is in Washington, D.C. And after I got out of the military in 1998, I stayed in the area. But I kept my affiliation with Walter Reed. I am also an associate professor of medicine at the military medical school, as you allude to. The county that I started doing private practice in has a very large African American population, and African Americans have a higher prevalence of lupus than most other ethnicities and races. And so I started to see a lot of lupus patients, which was my interest even before going there. And I've built up a lupus practice ever since. Ever since college, I've always been interested in teaching. I'll never forget in physics class, I asked a physics teacher a simple question and he could not explain to me how to figure out what to do. And I figured it out and I said, well, why didn't he just tell me it in that way? And so I've made it a goal all my life to simplify things in easy to understand language so anybody can understand. And I brought that with me to my to medicine. And I've been very motivated throughout my career to simplify things for patients so that they can understand how to take care of their own selves a lot better, and also even teaching medical students and other doctors. And so that's one of my passions is teaching and motivating lupus patients to take better care of themselves.
Well, I can certainly vouch for you simplifying things in the most positive light. I was sent, Don has a book out, but actually it's a second version, which Don, you can explain in a moment. So I just had, it is by far the biggest, most grown-up book I have ever received. And I have to say, my heart slightly sunk when I got it. And I was thinking, how on earth am I going to digest that? And you know, it was a real pleasure to read because I just found you explained it in such simple ways. I was thinking, gosh, I get this. I can understand this, and I know where to go and look things up. And it really was a joy to read, Don. But before we dive into talking about lupus and understanding it, the one thing that I really liked, which was that, funny enough, was I think it's the second from last sentence in this great tome, is you say knowledge, what is it? I've got to remember. Remember, knowledge is power. And nothing can be more from the truth, I think, particularly for people with any form of chronic condition. And in particular, you know, this book really does provide that knowledge, and it is aimed at both medical professionals and also for patients. And I would certainly say that if I had a condition, if there was a book like this for whatever condition I had, I would have this book in a heartbeat. Honestly, I think it's excellent.
Well, thank you, Katrina.
So let's say, well, actually, let's actually now talk about lupus. What is lupus?
Sure. The full name is systemic lupus erythematosus. That's the main thing the entire book is about. Systemic means that it can affect any organ system of the body. Lupus is the autoimmune disease. Erythematosus is the medical word for redness because it oftentimes will cause red rashes. It's an autoimmune disease. The immune system is that part of our body that usually protects us. It's made up of white blood cells, and if foreign invaders like like bacteria or poisons or cancer cells even get into our body, the white blood cells recognize those as foreigners. It attacks it. It keeps us safe.
Uh-huh.
But in people with autoimmune diseases such as systemic lupus, the immune system can't tell the difference between a foreign invader and the person's own body. For example, arthritis is one of the most common problems in lupus. Their immune system looks at the joints, thinks it's a foreign invader, attacks those joints, causes inflammation, which causes pain and stiffness, and sometimes even will destroy the joints over time as well. There's a lot of autoimmune diseases, by the way. Rheumatoid arthritis is one of the most common. It mainly attacks the joints. Sjogren's disease is another, and those patients, it attacks the glands of the body, especially causing dryness, especially dry mouth and dry eyes. Scleroderma is a disease that attacks the skin, causes hardening and thickening of the skin. Autoimmune thyroid disease is by far one of the most common. It attacks the thyroid gland, and then people have to take thyroid medications all their life. But systemic lupus can attack every single organ system of the body, which many of these diseases can, but there's some that are very specific for lupus. For example, how can you tell the difference between lupus and one of these other diseases? There's certain things that are classic for lupus. One is the butterfly rash. People go outside, they'll get a red rash on this part of the face. It looks like the shape of a butterfly and the reason for that, by the way, is ultraviolet light makes lupus worse, and that's where the sun hits most prominently on the face. But only 30% of lupus patients will actually get that. 45% of our patients, it will attack the kidneys. They'll get something called lupus nephritis. Nephritis means inflammation of the kidneys. It's one of the most common, or it's one of the major problems of morbidity and mortality or death in our patients, unfortunately. And then there's other certain rashes that are very classic for lupus, and pleurisy is another common problem where it attacks the lining of the heart or the lungs, and it's very painful to take in a deep breath. Low blood counts, for example, very low platelet counts. Platelets are important for sticking together, keeping us from bleeding, and that's one of the things that can help us tell the difference between lupus and the other autoimmune diseases. There's also genetic diseases, Katrina, and most people don't realize that. Over 180 genes have been identified so far that can predispose someone to having lupus. But most people who get the genes never get the disease. For example, you can have an identical twin, and you can have systemic lupus, and the other twin doesn't necessarily have to develop it, because it takes environmental triggers to cause the disease to happen in the first place. And that's a big part of my book. It's very important for people to identify what triggers can cause and make lupus worse, and try to avoid being exposed to those as much as they can.
I mean, reading through it, I just suddenly thought, oh my goodness, this is a really concerning condition because of the areas and how many areas it seems to be able to attack. But having looked at that, and knowing from learning from both yourself directly, Don, and the book, that it can take 4 to 6 years to diagnose, where do you start off saying, well, I've got rheumatoid arthritis, but how would you know, as you said, the difference between the two? And do doctors generally know the difference?
Sure, that's a good question. Let's say someone is diagnosed with rheumatoid arthritis, so they already have a systemic autoimmune disease. Most doctors do know to look for other systemic autoimmune diseases, because people can have more than one, or they can have, the doctor may think they have rheumatoid arthritis at first, and then it can evolve into another one, such as systemic lupus. And the reason for that is, for example, inflammatory arthritis, which is the hallmark of rheumatoid arthritis, can happen in every single systemic autoimmune disease. And that's why we rheumatologists are arthritis doctors. And that's the whole reason we're the experts with taking care of these diseases. And then the blood tests that we look for example, we look for rheumatoid rheumatoid factor, an anti-CCP antibody to help diagnose rheumatoid arthritis. But 30% of lupus patients are also positive for those. So someone could have early lupus and it can look like it's rheumatoid arthritis. And so most doctors know to check all the lab tests, like to check anti-nuclear antibody, for example, which is the screening test for lupus patients. And so hopefully they're checking for all of those things.
And is lupus, is it a common condition to have, or?
It's more common than people think. The Centers for Disease Control, during the past decade, they financed to have 2 large registries in the United States to answer that question. The final answer is not really known because lupus is so hard to accurately diagnose. There's a lot of people who are not diagnosed out there who have lupus, and there are some people out there diagnosed with lupus who do not have lupus, for example, because it is so difficult to diagnose accurately. But in the registries, for example, in the Georgia registry, 1 out of every 200 African American women did have lupus in Georgia. So that just shows you how common it can be in some ethnicities. And then a little known fact is that the registries also showed that in our American Indian and American Alaskan natives, they actually had the highest prevalence of lupus, and that's under talked about. And that's also a very good example of healthcare disparities, by the way. Those are Native Americans are not talked about and treated as well as they should be, but they have the highest prevalence and the worst lupus out of all the races and ethnicities.
And one fact that I saw in your book was, which was quite surprising, is that 90% of people that have it are women.
Yes, and there's a lot of reasons for that, by the way. For one thing, a lot of the genes that cause lupus are on the X chromosome. So a man gets an X and a Y, and a woman gets 2 X's, so she already has twice as likelihood of getting those particular genes than the man does. And then also, you as a woman, every single cell that you have has 2 X chromosomes, and normally what should happen is that one of them should inactivate itself so you don't have too many of the same types of genes doing things to that particular cell. Lupus is such a weird disease because what happens is that some of those lupus genes actually they resist inactivation and they stay activated. So here you have a double chance of those genes actually being active. And another reason is that estrogen causes increased immune system activation and increases the immune system to become overactive, and that's why we see it most commonly in women of childbearing age when they have those estrogens becoming very, very active in the body. Then there's a very strange thing called microchimerism. Microchimerism means, let's say that you have a baby boy inside of your belly. Some of his cells can go through the placenta and try to get into your body. Your immune system should attack them and keep you safe. But sometimes those cells will actually lodge into the mother's organs and stay there for the rest of her life. And then that can cause the immune system to become overactive, trying to attack it. And we know that because we can identify those XY chromosome cells inside of the organs of lupus patients, actually, especially lupus nephritis patients. So women have all these different things that can potentially cause it. Plus, 1 out of every 2,000 women have something called triple X chromosomes, where they have 3 X chromosomes, so they're even 3 times more likely to have those genes. And most women who have trisomy X don't even know they have that particular genetic abnormality. So a lot of interesting things cause that problem.
And is there an age? I don't know how young you can be to get it, or do you get? How does it work on age?
Sure. The youngest we can see with lupus, and I forgot to mention there's several different types of lupus. There's a systemic form that I just talked about. There's cutaneous that only affects the skin, and I consider that just a mild form of the systemic form. There's also drug-induced lupus. A drug can cause lupus to happen, and you take away the drug, it goes away. But there's another one called neonatal lupus, where antibodies in the mother, particularly anti-SSA antibody, goes through the placenta into the baby and then causes inflammation of the skin or the heart and causes lupus to occur when the baby is born. If it's the skin problem or other things like liver inflammation, it goes away within 6 months because the antibodies go away. So little tiny babies, newborn babies can get it, but that particular type goes away. After that, any age can develop lupus. I think the youngest was around 1 year old. That's reported in the literature, or a little less, with systemic lupus. And I have patients who were diagnosed in their 80s and 90s. So every single age can get it, but the vast majority are in the childbearing years. For example, only 15% of our patients develop it initially after the age of 50 years old, but teenagers get it, before puberty. Patients get it. When we look at our adults, 1 out of every 5 adults developed it while they were children.
And do we know why people get it? Is it a combination of factors?
Yeah, the more genes you inherit, the more likely it is to develop the disease. There's some genes that are much more likely to cause lupus than others. Like, for example, some genes will cause deficiency in a part of the immune system, and that particular patient may have a 75% chance of getting lupus simply because of that one gene. Someone else may inherit 20 genes that have just a mild increased risk of causing lupus, but since there's 20 of them, they have a much increased risk of getting it, and we call that the genetic load. The more genes someone gets, the more likely, and if it's a gene that has a strong chance of causing it, they're more likely to get it. Most patients who get these genes, though, it takes triggers. For example, cigarette smoking is a big one that we know of. Cigarette smoking, the poisons that are in those cigarettes actually change the molecules around DNA and can cause them to increase the risk of turning on those particular genes that can cause lupus. Ultraviolet light is a big one. Ultraviolet light, it contacts the skin, damages the cells underneath the skin. Those cells release their nuclear contents, and then just think about it. Lupus patients have these antibodies, like anti-nuclear antibody. It looks at those parts of the cells, thinks they don't belong there, and then that can trigger the lupus to develop in that particular person. Other triggers that can do it is, for example, some foods, alfalfa sprouts and mung bean sprouts, has been associated with developing lupus if they eat too many. Echinacea, a supplement that increases immune system disease activity, can potentially trigger it as well. Stress is a big one. There's more and more studies that show that people with post-traumatic stress syndrome have a significantly higher chance of developing lupus than other people. And just one example is when our soldiers started to come back from the Afghanistan and Iraq wars. They looked at the soldiers coming back, and those soldiers who had PTSD had a significantly higher prevalence of lupus soon after returning compared to soldiers who did not have it. And there's many more examples in that. And that's just a few examples of triggers.
Yeah, funnily enough, you've just answered one of my questions, because I did notice that one of them was said, at the end of your book, you have this most amazing checklist for the secrets of lupus, and you said about echinacea, and I was thinking, oh, and it said, and then you say anything that, but I think it was anything that boosts. I can't remember what it was.
Boost the immune system.
Yes,
you did good.
shy away from it.
Yes. And people are surprised at that. They think,
Yeah.
well, my immune system's abnormal. I should be helping it. But that's the whole problem with lupus and all autoimmune diseases. The immune system is already overactive, attacking the body. The way to treat it is to calm down the immune system, try to get a healthy balance. But here you have this overactive immune system, and if you give a supplement that boosts the immune system, it just becomes more active and is more apt to attack the body. I'll still never forget a young man I saw at Walter Reed. He developed scleroderma, where his immune system was attacking his skin, causing it to become very hard and very, very thickened, and lung disease as well. His parents were giving him a lot of echinacea. They thought they were doing the right thing for him, trying to protect him from colds, because that's what it says on the bottle. It prevents colds, but unfortunately it can cause problems like that.
Gosh. it does make me realize that health is such a minefield of, you know, to go the right path. Now, I know one of the things that we mentioned earlier is it takes such a long time to diagnose, presumably because it can present itself in so many ways. But I also am very aware that it's important to get a diagnosis as quickly as possible in order that you can get onto the management route. And so what is the best process to go through?
Sure. Of course, if you feel sick at all, you should always see your primary care physician and let them tell them every symptom that you have and have them do the appropriate workup. Um, but Katrina, unfortunately, our laboratory tests today are just not very good. The labs that we use to diagnose lupus are over 55 years old. You see medicines advancing just at a rapid pace because technology is so amazing. There's a huge problem in the world, in the United States and in Europe and other places, that the ability for laboratory tests to advance from the lab into clinical hands, there's so many obstacles and barriers. It's horrible. So that's one big problem, is that our tests are not very good. But let's say that someone is ill and sick. Hopefully your primary care physician will recognize that lupus is a possible cause and do the anti-nuclear antibody test, which is the screening test. If the anti-nuclear antibody test is positive, then they should do other tests, look for other antibodies that we can see in lupus, such as anti-Smith antibody, anti-double-stranded DNA, look for complement levels to see if they're lower or not, but also check all the other antibodies that we can see in all the autoimmune diseases, because they can all look like each other. So they should also be checking rheumatoid factor for rheumatoid arthritis, for example, but also looking for the things that lupus can cause. Check blood counts to see if the blood counts are lower than normal. Check the liver enzymes, see if anything's causing inflammation of the liver, and most importantly, checking a urine protein level to make sure that there's no increased protein in the urine, because 45% of our patients will get lupus nephritis, and so it's important to look at that. And then unfortunately, lupus, people are born with the genes that cause lupus. There's a trigger that turns it on. A lot of people, the immune system just starts to slowly become more active. So let's say that someone starts to get some achiness and horrible fatigue. Their quality of life is horrible, but all their lupus is doing is causing a positive ANA and nothing else on the blood work. The doctor can't say that that's lupus. That could be just as well, it could be a viral infection. It could be parvovirus, because those can do exactly the same thing. So that person could have lupus that whole time, not be diagnosed, go on brewing, and then all at once start to get maybe some sores in the mouth. Okay, that's a non-specific problem too. Maybe get a non-specific rash. And this whole time, they can actually be getting organ damage, because lupus is causing inflammation throughout the entire body, to include the blood vessels of the body, which predisposes their risk of heart attacks and strokes at a young age. It's not until they start to get certain things that fulfill what we call criteria for helping us diagnose lupus, like a low platelet count, a low white blood cell count, pleurisy, and things like that. And once someone gets several different criteria, then we feel confident in making the diagnosis. But we have a long way to go in improving that system. And because of those problems, there was a group there was two surveys, one by the Lupus Foundation of America, one by Lupus UK. Both of those showed that survey from their members, and there was an average of 6 years before a diagnosis of lupus was made. There was an average of 4 different doctors seen during that time before the diagnosis was made as well. And of course, those could be wrong, because, do those people really have lupus or not? But there was a group in Dusseldorf, a group of rheumatologists who proved in their clinic it took an average of 4 years, even with rheumatologists making the diagnosis. Those who were diagnosed later had permanent organ damage more often. And the permanent organ damage is a horrible thing. At the 1 year mark, about 30% of lupus patients will have permanent organ damage. And by the 5 year mark, 50% of them are, and these are young people on average. These are 30-year-old people who's getting permanent organ damage. I'm 62 years old and I have no permanent organ damage. So this is a travesty, and we definitely need better diagnostic tools.
Absolutely. And I think, and we'll go on to the, I've mentioned it, your secrets list. And I think one of them is, which I think it applies to all health conditions, is that when you realize that something's not right, but you can't put your finger on exactly what it is that you record all your symptoms, because we can never remember what they are, when they are, how they presented. And having that list must be particularly for diagnosis of lupus, whereas you might put a few things together and think, oh, that's not a problem. But when they all start coming together, you suddenly start seeing the full picture. Must be much easier to start really joining the dots.
I'm so glad you mentioned that, because if you were to ask me how I was feeling 2 weeks ago and what was going on, I am not going to remember. And so it's the same with someone who's having these types of problems going on. So a couple of pieces of advice on that. Number one, do record when problems happen and the dates that they happen, but don't make a lengthy, don't go into a long description of everything, because you don't want to go into a doctor's office with 10 pages of written notes that's going to take them 2 hours to read. But if you're very succinct and to the point, this date, I felt chest pain when I took in a breath. This date, I was so horribly fatigued and my knuckles hurt and they were swollen, things like that. That's how you want to do it. So that's a great point.
So as soon as, you present to the doctor, they suspect it's lupus, they do the tests, and then they say, yes, we're pretty sure you've got this. You then go on a management course of treating things. And can you, I know it's very difficult once you have done damage to organs, but is it possible with some organs to sort of get back better functionality?
We can reverse the active inflammation. So we want to prevent permanent organ damage, because by definition, permanent is permanent. But what we can do is reverse the active inflammation part. I might be making things sound scary, but with proper treatment, most lupus patients today will live a long, normal lifespan. But the trick is to have proper management and take the medications and do everything that the doctor says, because 50% of our patients do not do that. With treating lupus and managing lupus, the three most important things for treating lupus in my mind are: number one, taking a medication called hydroxychloroquine or chloroquine. It's an anti-malarial. It's a medicine that calms down the immune system, but it doesn't suppress it, so it doesn't increase the risk of infections, but it has an amazing number of benefits, like it decreases cancers in the patient, it decreases infections in the patients, but also it increases the chances of going into remission. It's the only drug that's been proven to increase survival in our patients. Number two is ultraviolet light protection. They need to protect themselves from UV light. I get skin cancer, so this light bulb up here is a LED bulb because it gives off no UV light. If someone has incandescent light bulbs in their home or fluorescent, that's contacting their skin and it can make their lupus active. So another trick is they need to use sunscreen religiously all the time, even if they don't go outside. So sunscreen is my second drug for treating lupus. Number three, low vitamin D levels. Low vitamin D is essential for the immune system to work properly. Studies show that in animals, if you take animals, our white blood cells, they have receptors inside of them, attachments for vitamin D. That white blood cell does not work properly unless vitamin D goes from the blood into the cell and makes it normal. But when people have low white blood cells or low vitamin D, the white blood cells don't function properly. The immune system becomes abnormal in lupus. But we know that if we supplement those patients with vitamin D and get their level to 40 to 80, that's our magic cutoff, and that's in nanograms per milliliter, that helps their immune system. So those are the three magic medicines for all my patients: is hydroxychloroquine plus sunscreen religiously plus vitamin D, because none of those suppress the immune system. And I'd say about 30% of our patients are able to get into remission with those three. If those three are inadequate, then we need to use a medicine that suppresses the immune system on top of that. And the faster we do that, the better. We want to get them in remission as fast as possible after diagnosis.
Yeah. And that's amazing. I don't know about the first one, it's interesting that it's a drug for malaria, but the fact that it can be used, which
Mm.
seems to be a theme at the moment with lots of things we're discussing, is actually there's a drug for this, but actually it's used for that, if that makes sense. And
Yep.
then obviously, skincare, we all know how important skincare is. And the vitamin D just seems to come up all the time for people to be on a vitamin D dosage of some sort, seems to be really important. So just sort of wrapping up, what we will be doing is putting at the bottom of this and also in our articles a link to your website, because it has so much information on there for everybody. And as you said, in such an easy way to read for people like myself to understand properly. But it does have the Lupus Secrets checklist, which I just think is amazing. It's 3 pages of boom, 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 boom. Really easy to understand. This is what you need to do. This is how you need to do it. But maybe it doesn't suit you, so then check with a healthcare professional if necessary. It just seems to be really simple. And I think when you have such a concerning condition, to have something spelt out to you in very simple terms, things that you can understand, that you can implement straight away, it's a godsend, I'm sure.
Yeah, because most people feel lost when they're diagnosed with lupus,
Yeah.
and there's so much information out there. You're absolutely right. And one thing I'll add, Katrina, is those people out there with lupus right now who are scared that their children may get it, which they do have a higher risk, by the way, have them avoid those triggers on the lupus checklist. More and more lupus experts are recommending that. So making sure the vitamin D is normal, never suntan, use sunscreen regularly, never smoke cigarettes, avoid echinacea. So those are important for the children of people who have lupus as well.
Absolutely. Well, Don, it's been a pleasure to meet you, a pleasure to read your book, and I'm sure that we'll be helping other people with lupus and giving them comfort. I mean, giving them great comfort after listening to this, I hope, and in particular reading your book. So thank you very much, Don.
And thank you so much, Katrina. And remember, everyone, knowledge is power.
Indeed. Thank you.
All right, bye-bye.